Hi, I'm Dr. Keshava R, Director, Head of the Department Cardiology, Manipal Hospital, Old Airport. Today we are discussing about TAVI. What is TAVI or TAVA? TAVI means transfemoral aortic valve implantation. So normally aortic stenosis means one of the valve in the heart is called aortic valve, it's narrowed. When it is narrowed critically, we call it severe aortic stenosis. What are the symptoms of severe aortic stenosis? Patient will have breathlessness on exertion, on walking or on climbing staircase, or he will have chest pain on exertion, or he will have a blackout. Whenever we have this, we'll do the echocardiogram ECG and come to a diagnosis, valve is narrowed. What are the options of treatment for a aortic narrowing or aortic valve narrowing? Aortic stenosis we call it. If it is mild, moderate, we say take medicines. If it is severe, we need to do the replacement of the valve, aortic valve replacement. Previously, last 10 to 15 years ago, aortic valve replacements were surgical. They used to replace the valve with a open heart procedure, and aortic valve will be removed and put a new valve. Now, that is the ideal situation, but there are people who are high risk for surgery. Somebody who is above 70 years, somebody who has a lung issue, somebody who has either past history of a stroke, the risk of surgery will become very high. When the risk of surgery is very high, TAVI is indicated. TAVI is the same as aortic valve implanted, but through the groin artery under a local anesthesia. Through the groin, we pass the valve. So there are two types of valve. In this type, you can see that this is the valve which is mounted on a balloon which is sent from the groin artery. You inflate, that new valve will function, the old valve gets compressed and the new valve will start functioning immediately. So the patient valve area immediately increases, patient will become better. This is a balloon mounted valve. This is another one is called self-expanding valve. This is a valve which is crimped on the thing. Once you start deploying, because of the body temperature, it expands to the size. Important thing to realize, what are the complications in TAVR? 2 to 3% risk is there. Small risk of stroke of 1 to 2%. Need for pacemaker of around 5% is there. Bleeding chances will be there. But overall, 95 to 96% of the time we will be able to give a good result based on the CT scan. So please consult your doctors. Please consult Manipal Hospital group if you have any patient suspected of aortic stenosis. So with the heart team approach, we will decide whether you are good for a TAVI or TAVR or by surgery. Thank you.